I'd like to introduce Dr. Roshni Carvalho. She is a board-certified pharmacotherapy pharmacist who has been working in the psychiatrist space for the last decade. Her work primarily focuses on education surrounding psychopharmacology, comprehensive medication management, schizophrenia, depression, and anxiety. Her passions include mental health and patient advocacy, mental well-being, and destigmatizing mental health. Please join me in welcoming Dr. Carvalho.
Hi, good afternoon, everyone. Thank you so much for having me. I know it's been a long day. So hopefully this will kind of help you guys de-stress from the day, practice a new meditation skill maybe, and then kind of take that home with you guys. So today I'm going to be discussing mindful meditation and mental health. So what we're going to do is I'll kind of go over what is mindful meditation. We'll discuss a little bit of how it's done. We'll go into the science just a little bit, just, some of the data we have to see, whether it works or not according to clinical trials. And then we'll end with Janelle. She'll be going over you guys practicing a type of meditation before you guys get out of here. So I am a pharmacist by training. I work for Otsuka Pharmaceuticals. This presentation has been brought to you by our company, and I'm a paid employee of the company, so just kind of wanted to put that out there. So some of you may be wondering, or maybe you already know, what is mindful meditation, right? So mindful meditation is a family of meditation practices that shares an emphasis on reducing distraction while also enhancing awareness of present moment experience. So the concept of mindful meditation was developed through mindfulness-based stress reduction, or like ideas from this concept. So mindfulness-based stress reduction was actually created because there were a lot of ambulatory patients that had debilitating stress, right? So with this practice, it was a way to help with some of, that debilitating stress. Since then, there have been other practices such as mindful-based cognitive therapy. So with mindfulness-based cognitive therapy, that kind of really focuses on helping patients who may have depression. We also have mindfulness-based relapse prevention. So that program is kind of geared more towards substance addiction. And then there's also brief mindfulness meditation training interventions, just with the different subgroups when it comes, within the mental health space. So you guys may come across a lot of instructors that say, we do meditation in class, right? I know if you go to a yoga class, you kind of end with this meditation space, but someone who actually provides meditation, an instructor, it's a long course. It's an 8-week course where they're going multiple hours a week to learn the didactics of the science and how to really implement this practice. They're also given these homework, like 45-minute sessions at home to go home and practice or learn these skills. So I think it's easy for people to say, oh, I do meditation, I can help you with it. But really, it's a training program that someone has to go through to make sure that they're giving impactful practices, especially when it comes to helping with some of these mental health disorders. So just some methods that you would go through when you're going through this practice is first, your posture, right? You can do mindful meditation by being seated, laying on your back, walking around, or even being in a yoga position. And with this concept, you want to begin with the focal object of meditation. So I'm going to use breathing as an example, because I think that's something that we all commonly may have heard or even tried, right? Using breathing as our main object when we're focusing on this meditation. You want to make sure you're having an open and curious attitude towards this experience. And you want to attend this moment by moment to the object, so meaning breathing in a neutral way. I've tried meditation. I know sometimes it's hard to be neutral, so it's definitely a learned practice that you may not get on your first try, but something just to kind of keep in mind as you're practicing this. You also want to make sure you're having a relaxed awareness for distractions. There are many times when you're trying to do meditation where distractions are out of our control, right? Whether it's a family member, a kid, noise around you, it's easy to kind of get distracted. So when that happens, it's important that you notice the distractions, but try your best to not use judgment or react, and kind of address this distraction if you have to, and then return your attention back to this object, which we've been using breathing as an example. So with mindful meditation, there are core targets that you're trying to reach. So the first one is meta awareness, and this is the ability to monitor and report on current thoughts. So a good example of this is to able to identify when you're starting to daydream about a vacation while you're trying to read a book, right? Just even when you're practicing this breathing and you start seeing your mind wander, that meta awareness piece is making sure you kind of can catch yourself and kind of bring that awareness back. The second core target is present-centered awareness. So this is keeping attention on current mental content as compared with past and future thinking. A good example of this is focusing attention on breathing instead of thinking about what you're going to have for dinner tonight or a Christmas party or something that happened last year. The third target is not reacting to experience. And this is stopping usual emotional reactions to a current experience. An example of this would be, instead of feeling anxious, having an open attitude when you notice that you are breathing fast. And the last one is de-ridification. So if you've spoken today or you've done any public speaking, this one is something that you may be able to relate to, right? This is recognizing that your thoughts and experiences are not true reflections of reality. So I bring up, if you spoke today or if you've been a public speaker, because an example of this is knowing that your thoughts about an upcoming presentation are not real deficits of what's going to actually happen during this presentation, right? A lot of us, especially if we're newer to speaking, may get worried that you're going to say something wrong or not know anything, but we don't really know that's going to happen until you get there. So there have been some results or theories of mindful meditation that has been tested, and let's talk about how this actually affects changes in thinking and changes in emotion. So to go over changes of thinking first, when we're thinking about cognitive control, the results have been mixed of whether mindfulness meditation can have impact on cognitive control. However, there have been improvements that have been seen in meta awareness, right? The core targets we talked about, cognitive flexibility, recalling details to memories, and mind wandering. And lastly, there is strong support for reducing attention being captured by distractions as an important reason by which mindfulness meditation can improve mental health symptoms. Switching gears to the emotion side. So the results of enhancing emotional awareness have been kind of mixed of whether it works or not. When we're talking about changes in emotional reactions, repeated experience of emotional states without avoidance may lead to adapting or loss of trained emotional reactions. Thinking about the restructuring of thoughts, right? So there is evidence lacking of whether mindful meditation can help restructure thoughts. However, reduction in stress has shown to be partially due to self-reported reappraisal. And lastly, that altered reward processing. So there has been evidence that's been actually emerging in this section, especially when it comes to things like smoking, where this can be impactful. Here we have some results from a meta-analysis that looked at over 12,000 patients. And in this meta-analysis, with these 12,000 patients, they looked at mindful-based interventions and compared it to what it looked like when someone had no treatment at all, what it looked like when they were given an active control or evidence-based therapy. So as we can imagine, right, mindfulness-based intervention did better in terms of depression, anxiety, pain, schizophrenia, weight or eating disorders, as well as substance use or addiction compared to doing nothing at all, right? So this result to me was not as surprising, but it's always nice to kind of get that reinforcement where, hey, something is better than nothing. The next one, we're looking at active control, that mindfulness mindfulness-based interventions did do better in terms of patients who had depression as well as substance use or addiction. And for patients who had anxiety, pain, and the weight or eating disorders, it was balanced, it was equal. And lastly, comparing it to evidence-based therapy, right? These are approved therapies that are on the market. So the mindful-based interventions actually worked better for people who smoked compared to taking medications. However, with depression and anxiety, it worked equally, which also makes sense, right? We know when it comes to mental health, medications could be important, but it's not the only thing that's going to fix a lot of these different interventions that we keep up. The practices that you kind of take with you is what's going to be important in kind of keeping some of these symptoms at bay. Not all the time, but for the most part, hopefully they can. So as you can imagine, with any type of intervention, whether it's medication or a therapy type, there's always going to be challenges as well as advantages. So we talked about the teacher training, right? A lot of people may say, I know how to do meditation, I can help you with this, but it's really a learned practice. It's kind of similar to like a yoga instructor or a gym instructor, right? Someone who's gone through this training is really going to be able to deliver that impactful practice. And so the flip side to that is that there have been skills that are developed to help monitor the quality of these mindful-based interventions. So that can kind of tell you, is this person improving if they're improving on the scales, right? Is it helping them or is it not? We talked about it's a very lengthy treatment, or it's a very lengthy training process, right? It's an 8-week course. It's not easy. It could be time limiting. The format of the training could be difficult. And also, like, sometimes someone may not have the appropriate practice setting to deliver this type of intervention. However, I could say one good thing out of COVID is that it's really opened the doors for a lot of virtual options, right? A lot of things that we didn't realize we can do virtually now, there's options. It might not be the same as in person, but at least it exists. So that's the flip side of having the challenges of someone that may not be able to deliver it, is they may be able to do this intervention online, especially when it comes to depression, anxiety, and well-being. Those are the 3 disorders that could benefit from virtual. And lastly, there aren't culture-specific versions of traditional mindful-based interventions that are currently available, especially right in California. We live in such a diverse community that this is unfortunate. But I think there is promising support, right? Things are being developed, especially when it comes to underserved backgrounds as well as that diverse background. So there's things that are changing, there's things that are coming to practice. And I think as more people get trained and kind of figure out this can work for them, that can open those doors as well. So to kind of wrap up everything today is that mindful meditation is a family of meditation practices that shares an emphasis on reducing distraction, as well as enhancing awareness of present moment experience. Evidence for mindfulness meditation improving function in cognitive and emotional factors. This intervention can be comparable to established treatments for symptoms of depression, anxiety, pain, and substance use. And lastly, while advances have been made to improve access to delivery of this type of intervention, it's still a continuing work in progress. It's additional challenges will come up, and as long as we continue to kind of implement this and work towards it, it could hopefully reach a broader scale. And to kind of wrap things up, if you are interested about PsychU, it is our disease state platform. You can go to psychu.org. There's a lot of good resources, not just for providers, but for caregivers, advocacy groups on different topics like this, well-being, or any current topics that are trending when it comes to depression, anxiety, bipolar, schizophrenia, any of that. So now I'm going to hand it over